Okay, experts warning that the actual number of cases here could grow significantly higher. The virus is contagious during the incubation period up to 2 weeks, even though people show no symptoms. So people boarding planes, traveling, showing no symptoms. And then there's this dire warning spelled out in an opinion piece in The Hill. This is China's Chernobyl, basically covering up. That's the allegation. Let's bring in retired U.S. Army Lieutenant Colonel James Carafano of the Heritage Foundation. Your reaction to this?
Well, I think the U.S. and other developed countries are actually in pretty good shape. It's what's called ring containment. If you have a case and you outbreak and isolate them, I think you can do a relatively competent job of kind of keeping them contained. Here's the real problem scenario. The Chinese have workers all over the world. Let's say you go to a place without a really developed healthcare system and good infrastructure like Sudan. If it gets there, it's going to get everywhere, and because that's the real problem.
That's an important point. You know, it took SARS up to about 3 months to come close to the fatalities now reported from the coronavirus in less than 1 month. Cases in China are exploding higher than the eventual number of cases in SARS last decade. In the end, SARS hit 17 countries. It's now in 19 countries, the coronavirus. Critics say that the Cold Spring Harbor lab reports that the super spreaders, one person can potentially spread the virus to 3 or 5. So your reaction to all of that?
So here's what I don't know, which is the state of Chinese healthcare. So a lot of these cases we hear about people getting pneumonia and dying. So we don't know, is this a case where this is a particularly virulent strain and it's killing the kind of people that we wouldn't expect a virus to really kill, healthy people with normal immune systems, or is this just the Chinese healthcare system not keeping up? If you get pneumonia, even if it's not a killer strain of pneumonia, and you don't get appropriate care, you're going to get very sick and you could well die. So are the high Chinese numbers because the Chinese healthcare system is failing, or because the disease is particularly virulent?
That's a great point.
I think is important information.
That's a really important point. That's an interesting, important point you just made. You know, critics say China must outlaw forever its live animal markets. It's been blamed for multiple epidemics, coronavirus, SARS, MERS, African swine fever, and more. Also for their depraved, inhumane abuse of animals. You know, China is already slowing down. GDP there now forecasted to drop below 5% for the first time since the early 90s. And Chinese government economists forecast that the coronavirus could be significantly a bigger hit than the SARS outbreak. Your reaction to that?
Well, this is kind of like an MMA fight. This is like the 7th hit that China's taken. I mean, complaining about the Taiwan elections, the Hong Kong, 5G, BRI. The China brand has been so diminished. And the way the Chinese have handled this has been very, very poor. They haven't invited in experts from the United States. They're reluctant in sharing information. They've excluded Taiwan from the World Health Organization. Again, this is another kind of slam at the Chinese brand. And think if you're an American company doing business in China like Starbucks, where you're shutting down all your businesses. China is in real danger of destroying its own reputation. And so for the sake of its own reputation, banning these markets would be like, you have to do something to regain your international credibility.
Yeah.
Banning that markets might not be a bad place to start.
That's a great point. You know, good news. What do you think of this? Scientists reportedly in Australia, for the first time, replicated the virus in a laboratory. It could potentially lead to a breakthrough in the quest for a vaccine, but that could be months away. Right. Your take on that?
We often talk about, well, we need a vaccine, but with many of these viruses, which often mutate and change, remember, every year we give people a flu virus, and we're just guessing about what flu they're going to get, right? So the notion that there's a vaccine way out of this is probably not the best idea. The social distancing, the isolating, stopping the spread of the virus to begin with, I think that has to be the emphasis of the strategy. Good health infrastructure, good health care, good monitoring, good response. We could spend trillions of dollars and maybe get a vaccine, or we could do these other things and prevent people from getting the disease in the first place. I think right now that has to be the focus of the global health effort.
James Carafano, great to see you, my friend, and thank you for your service to our country. Come back soon.